The instruments that we used are one part of the success. Even our experience, also we should use qualified instruments during the surgeries. Because you know that every surgery has a complication rate. I explain my patients the risk of complication and the things that affect the complication rate in some steps. One is the experience, of course, and the second is the quality of the instruments. In our clinic, we select accredited instruments for the surgeries. Especially the staples are very, very important. There are a lot of trademarks for the staples in all around the world. And also in recent years, we are hearing new trademarks about staples. I think this is about the cost, of course. If you select to use a low cost instrument, so it means that you will have a high rate of complication. So this door is closed for us. We don't select and we don't think about the cost, and our first thinking is about our patient's health. For that reason, I think this is the important concept of the success. We are preferring to use staples which have been approved by the FDA especially.
And also we shared all packages with our patients that they know that which material used in their surgeries with serial number. They can check if it comes from the real trademark or not.
A surgeon cannot do all surgeries, cannot treat all the patients. If a surgeon is specific to any disease, the result is better than everything. For that reason, in our clinic, we only do weight loss surgeries. So this brings the success, of course. And also, when you do a specific surgery, you can follow up the recent literature. It's one part of the success also, because surgery and the treatments change very, very, very fastly. For that reason, you can follow the literature. In our team, we are very rich about surgeons and other members. For that reason, we are following the literature very closely, and this is another advantage. And if you are a specific clinic, you can do a lot of patients, treatments. So it means that you are a high volume clinic, and it is also one part of the success. We have patients all around the world, that's true, and also there are a lot of patients which have been rejected from different clinics and they want to have their surgeries in our clinic. First of all, I think a large team is one of the key points about answering this question. We don't expect, of course, all patients. We are discussing all patients with all the team. If we can do that. This is not only our decision, also an internal medicine doctor, an anesthesiologist, a cardiologist, a pulmonologist are saying their recommendations about all the patients. So if we believe that there is no risk about the surgery and performing the surgery is safe for the patient, we invite her to our clinic. And the other key point to answer this question is, I think, the experience, of course, the high volume of our clinic. This is the second thing. And last part of the question is about our experience. That I remember a patient with a BMI of 83, I think.
Yes.
It was a heart surgery, but she discharged from the hospital in a routine 3 days, and after 1 week follow-up, and she's in her country now and without any problem. And an important surgery was asked me. It was a revisional surgery that had a Roux-en-Y bypass before in another clinic, and according to the weight gain, he attended to our clinic to do a knee surgery. We discussed it too much with our team. We do a lot of tests, a lot of scans. After that, we decided to do the surgery. It was, I think, 5 hours, and we attended all a team to the surgery first two of us and then change with two of us, and also it was a long duration of surgery, and I don't forget this surgery, but it's our happiness that our patient discharged with a very good health, and we heard about him that he lost about 50 kg after 1 year of this surgery. We are happy with these comebacks.
This is a very challenging topic for me because I always want to help high-risk patients, because obesity is a risk of its own. This is a risky disease. Sudden death is the most cause of sudden death is obesity. But we have a huge experience and our surgical duration is very short and low. And also we have a great anesthesia doctor. Because of this, and also a large, big team, because of this, I want to always help our patients, high-risky patients. But of course, we will explain and all details of risk of their surgeries, and we don't have any till now. I don't have any bad experience with this, and I'm very happy to hear their, and I am very happy when I heard their feedbacks and healthy conditions from now. Preoperative preparation is very important, of course, but we don't see our patients in the same surgery day. We evaluate our patients before they come with forms, and we give some advices about the medication that they use or diet. And also when they come here, we evaluate our patients with internal medicine doctor and cardiology, pulmonology, and anesthesia, and psychiatry doctors, and also our bariatric team evaluate our patients about the surgery. Sometimes we detect some disease like blood pressure and cholesterol, or sometimes diabetes. They don't know already, and it's very rare. But sometimes we detect any other tumors like kidney tumors. We have detected recently. So preoperative preparation is very important and essential, and this is a mandatory, and also it affects aftercare, because if the patients have diabetes or blood pressure, we change our medication, and aftercare is most important thing. We started the day very early, and we started our patient visit about 7 a.m. to 7:30. So after we check their blood tests who have undergone the bariatric surgeries, some do some adjustments with their patient's conditions, and we will evaluate the patients who will have the bariatric surgery the same day. And also we attend 2 surgeons, all surgeries. After our surgery is done, we will do another patient visit, and also we have some patient controls that they had the surgeries already. It's our day routine. We start around 7 until our surgery is done around 5 p.m. This is a busy day always.
And then another team comes, change with us our duties in the night shift, and our patients will not be alone after a daily routine.
It's of course daily routine, but if something happens different than normal day, of course we will not leave the hospital. Yeah, it's not a job, it's a lifestyle. Most complications occur in first days. So we consider first week is a critical time. We want our patients minimum 3 days in hospital and minimum 3 days more in hotel or in some other place. We have to check several times before our patients leave our country to their home. We don't have any rush. Safety is our first priority.
I think they will enjoy Istanbul also for the last days.
Yeah, enjoyable city Istanbul is. Our surgery day is very busy, so we cannot tell the exact time because most of our surgeries takes less than 1 hour, but sometimes the surgery time is longer than normal. So, and also pre-surgical assessment in every patient. Sometimes we need extra ultrasonography, sometimes we need extra MRI, so it changes time. But we can say that our surgeries start around 9 a.m. and till 12 a.m. So we can say 9 to 12.
Also, we are connecting with the operating room staff for the timing, especially in the morning visits. On that day, we are telling the possible time of the surgery to every patient on that day.
It's an ethical issue. So World Health Organizations say that it is not ethical less than 35 BMI. So just we tell several times our priority is our patients' safe and ethical issues. So we don't do surgeries less than 35 BMIs.
But if we hear about a new consensus, nowadays it has been discussed for the patients that have class 1 obesity between 30 and 35 BMI, weight loss surgeries. If there will be a consensus about it, if there is a new guideline of that, yes, we can think about it, but not now.